All right. So I think we're live. So first of all, welcome everyone to a special Trendy Tuesday Live with our CEO and co-founder, Dr. Sophia Yen. Hi there. And today we have a guest speaker, Kritika Joshi, a public health professional and our new women's health advocate. Hi, Kritika. Welcome.
Thank you. I'm so excited to be here.
Yay!
We're so excited to have you. And today, Kritika and Dr. Yen will talk about health disparities in women's health issues and how to address them. But before we start, I want to remind everyone that we have this exclusive deal right now. If you use the code CELEBRATE2021 on our website, you get a free online doctor's consultation. An amazing deal. Take advantage of it, girls.
Only for cash patients, though, because for insurance patients, we can't do that. It's a legal thing.
Thank you for mentioning that. Yes, that is true. So let's dig into today's topics. So if we are to start with the basics, Kritika, can you tell us what are disparities and why is this topic relevant to our fellow females out there?
Sure. So I'm going to start off just by reading a definition provided by the National Institute of Health. So health disparities are actually differences that exist among specific population groups in the United States in the attainment of full health potential that can actually be measured by differences in incidence, prevalence, mortality, burden of disease, and other health conditions. So I know I said a lot of different public health terminology, so I'm kind of going to break it down. So differences in incidence means differences in new cases that of any disease between populations. So that's incidence. Prevalence is the number of individuals with the disease. And the burden of the disease is those who actually have the symptomology of the disease and have been living with the disease. And then other adverse health conditions are just other symptoms that kind of supplement the disease as well. And so bringing it back to disparities are differences amongst these different definitions. And mostly you see disparities based off of racial disparities, gender. It could also be socioeconomic disparities, differences in education, class,
insurance.
Insurance and whatnot. And like even immigration status too. That's a huge one that a lot of us don't think about.
Yeah, so that is definitely relevant to many out there, with all those differences. So what are some of the disparities in women's health issues and services that we see today?
Yeah, so there's actually a lot of women's health disparities. So just in preparation of this live, I was looking up a lot of different disparities. And one of the biggest ones that I found was unintentional pregnancies. There are a lot of racial disparities with unintentional pregnancies. And what I mean by that is, for example, just to bring some numbers into perspective, in general, the United States has about 52 per 1,000 women aged 15 to 44 years old that have unintended pregnancies. But that rate actually increases with African American women, where the rate is 91 per 1,000, which is a huge difference right there. And even Latinx women at 82 per 1,000 women in that same age range. And the range is actually considering adolescent girls as well. So I think that's like a huge disparity that we see. And in addition, we have disparities in breast cancer. One of the biggest things that I found was that although the breast cancer incidents are similar between Black women and white women, the mortality rate by breast cancer is actually a lot higher in Black women. And so we need to kind of dive into why that is. And we'll talk about that a little bit later. And then cervical cancer has the same rates as well. And when it comes to prevention services, there are a lot of disparities in like HPV vaccinations and getting your pap smears. And so those are a couple of them. And Dr. Yen, you can expand if you want.
Yeah, no, you hit so many topics. So I was like, are we gonna break it down by the topic, or are we gonna just go by the mass topics and hit them all together? The reason I went into medicine was because for me, teenage pregnancy is so preventable. You can have sex, just don't get pregnant. We have so many good birth control options. And if you double it, so if you do condoms plus some hormonal or copper IUD form of birth control, then your chance of pregnancy is very, very, very low. But one, you have to have comprehensive sex ed, which is not required across the United States. And then you need access to confidential reproductive health care, which is definitely not within the access for many teenagers, even if it's the law in the state of California and in many states that the doctor cannot tell your parents that you are seeking birth control. And if they do, then you can sue the doctor. So that's how I I tell doctors they have the right to sue you. And then I tell the teenagers, you can sue your doctor. And that's like $1 to $2 million. So, and so you tell the doctors they're going to sue you. So don't break the law. And you tell the teenagers, go sue them so you can get your 1 or 2 million. But it's a question of what a teenager's confident enough, right? And would the court believe you? But it would be obvious because your parents would be all angry at you for having sex when they didn't know you were having sex or something like that. So I'm hoping that I'm hoping no one will break the law. But I'm hoping that if they do, the youth will sue them and they will get their money and then set an example to scare all the other physicians to follow the law. So at least they have access to it. And it struck me the most when I was a Planned Parenthood pregnancy results counselor. And I was 15, pre-med, buffing up my resume, but also want to be a doctor, ran a pregnancy test. It's kind of fun, And then the result came back positive. And I was like, oh my goodness, this is totally going to change the world. And to see that, it's her body, her choice, 13-year-old decided to continue the pregnancy. And I knew that she was going to go on a different path and I was going to go on a different path. I was going to go off to MIT, UCSF, Children's Oakland, UCSF, and then Stanford and Berkeley for an MPH as well. And then open a startup, was my future path. But a 13-year-old unmarried young woman, what are the odds she's going to graduate high school? What are the odds she's going to be able to provide for that child? What are the odds the father of the child is going to stick with her? And her life just could have been totally different if she had had access to comprehensive sex ed and birth control, because she did not want to be pregnant. And the percentage of unplanned pregnancies in teenagers is huge. It's like 80% of teen pregnancies are unplanned. So those 80% of them we could have prevented. And the other 20% we should have strongly encouraged that you don't want to get pregnant during your teen years. So...
And then there's a whole taboo. Sorry, but then there's a whole taboo part about abortions, and that could be both on a societal level, but also on a religious level. And it's just, I feel just personally, I think it's just so sad, when a young woman is, restraining herself because she, as a young woman, is stuck with the baby. No reason for her not to wait with that and follow her dreams. If it's working, then doing that and getting an education. I think it's just sad, and I really wish that people would normalize it, and because it's just so important, and it really just changes your life forever. As soon as you get pregnant and you're a mom, you can never you'll never go back.
I tell everybody it's not like an 18-year commitment. It's a till both you die commitment, right? And then I tell all the men, control your sperm, because once it leaves your body, it's the person with the uterus's decision whether to continue it or to discontinue it. And if she decides to continue it, even if she says, oh, don't worry, me and my mom will take care of it, you don't have to be involved, that kid's going to hunt you down and be like, where the hell were you my whole life? And they have every right to do that, right?
Yeah.
Very true. Very true.
And I was going to add, with access to just condoms and whatnot, when I was in DC and I was just kind of becoming exposed to disparities, and because I got my MPH in DC, and I had learned that they were actually locking condoms in the in like the most low socioeconomic areas because they were getting stolen and they were locking them. And because of that, like HIV was increasing, unintended pregnancies were increasing, and like children were basically having children because of a policy decision to save the supermarket a couple of dollars. Like, I was so livid.
Yes. No, I saw a similar in liberal California where they have the teen van at Stanford. And it's not the teen van's problem, but it's the school district that said if you wanted condoms, you had to have an appointment. And it's like, we're going to this high risk school where the kids are all dropouts to begin with. And so they're very high risk and they're sexually active if they're taking the condoms. They're not using them for fun or blowing up balloons, or even if they were selling them for money, somebody needs them, somebody's using them. But I don't think that was the case. But if you didn't get an appointment and the clinic could only have so many appointments in their 3 to 5 hour time span, but if there's hundreds of kids that want condoms, then they should have the condoms because, you know, they've shown in research for every dollar spent on birth control, the public system saves $7 and the private system saves $4. And it's not including the pre and postnatal care. It's not including the ruining the young person's life or the couple who wasn't ready at this time to have a baby. It's simply math. And so I always say it's fiscally smart and morally right to cover birth control, and that birth control should be free. No copay, no deductible, just should be free anywhere and everywhere. Because if somebody doesn't want to get pregnant, always cheaper to prevent it than to deal with the aftermath.
Yeah, birth control should be a civil right.
Yes.
It should, yes.
Yes, and good birth control, not just you only get condoms, but you get whatever, IUD, implant, shot, whatever.
Exactly, yeah. So
under the Affordable Care Act, they have made that for people who have insurance. And as long as your employer isn't evil and religious.
Yeah.
So if we reel it back, I have a couple other questions for you guys. Mm-hmm. So how are social determinations of health related to disparities? How are social determinations of health related to disparities? That's what I meant.
Social determinants of health related to
policy, housing, access.
So I think it plays a huge role because social determinants of health, so for those who don't know, are basically different aspects of health or different aspects of society that actually influence health. So, for example, housing. If you don't very open or not rat infested housing, right, you're going to have poorer health. Transportation, if you don't have a way to access your birth control, to be able to, and we can talk about Pandea's role in that in a little bit, but if you don't have a way to transport to get your care, that's also a determinant. Policies, so like we were talking about, we have like condoms being locked up. That's a policy that is causing negative health outcomes. And even the policies around some areas telling parents about the pregnancy, and some areas, and it's kind of finding their ways around that, like not providing birth control, even though it was in the Affordable Care Act. So I think like all of that determines your health and your health outcomes. And so that's what social determinants of health are. And we kind of just talked about that role in health disparities, because in areas where the disparities are high, there's a huge role of social determinants. Like the condoms are locked only in places where the children need the condoms the most. There is less Planned Parenthood's funding in areas where children actually need access, or women need access to that Planned Parenthood. And just in terms of like the past 4 years about Planned Parenthood not getting the funding, if they're getting shut down in an area with high need because there's a lot of unintentional pregnancies or there's high HIV rates, you're basically cutting off access to health for the individuals that need it the most. So that's kind of like how those two play kind of like a role together. That's
Yeah, and so, the beauty of Pandea Health, one of the reasons we created Pandea Health was because one of the top reasons women don't take their birth control and therefore prevent unplanned pregnancy was they didn't have it in their hand. They couldn't go to the pharmacy every single month in that prescribed week that the insurance company mandates. And most of us plan it such that you run out on Sunday. And so if you go the Sunday before, that's 8 days ahead of time. And their stupid insurance policy will only allow 7 days ahead of time. And maybe that's okay with other drugs. I don't think it is okay with any drug, but with birth control, if I'm there on Sunday for the next Sunday, please give me my drug. Don't make me come back the next day. But they're like, if you got to pay now, or if you come back tomorrow, then it'll be free. And you're like, I'm here now. I don't have time. I have work. I have children. I have other things. I'm here now. Give me the drug. And they won't give it to them. And so that is the critical reason, one of the critical reasons that we created Pandea Health, is that let us worry about it. We try to fill it as soon as your insurance will allow it. We test the insurance, like, will they let us fill it at 10 days? Will they let us fill it 9 days, 8 days, 7 days? And that way, we set it and forget it. Let Pandea Health worry so you don't have to. Our mantra is no one runs out of birth control on our watch. And it's also about care, convenience, and confidentiality. But also, as you talk about health disparities, is transportation. Like if you have to get on a bus, one, you got to pay for the bus, and two, you got to get on the bus. And then what if the buses are running slow? What about COVID? Just to have it come discreetly in the mail, on schedule, by itself, autopilot. That is the point of Pandea Health. And to bill it to your insurance. Don't make anybody pay for anything they don't want to do. So if you have Kaiser, don't come to us because we can't bill them, and ask Kaiser to mail it to you. And but if you don't have insurance, then we try to give you the most economical option. It's roughly $15 a pack for most pills, 3-pack minimum, or $20 a pack because we have to cover shipping, overhead, legal, all of our people that are texting you and providing amazing service. But we hope that you can, do 3 packs at a time. And then we also have Pandea Health Birth Control Fund, to which if you have money, please donate. It's tax deductible. But if you don't, you can apply. And people have generously donated it to help people cover birth control pills or the doctor's visit if you need that covered. But if you're cash, we're giving that free for this month.
And besides, getting your birth control on time and just not having to think about it in the package, there are actually goodies. So
yes.
it's like a win-win, like you don't even have to think about it, and there's an extra bonus in the package. So
yes. It comes with a free goodie. Sometimes it's High Chew, which a lot of people love. We've given out most recently really expensive soap, this company I love, and we got dinged because people are like, I don't like the name, and I'm like, it's not my company. It's just a soap company, and they're amazing soap, and they're giving it to you for free. So just use the soap and enjoy it. But it's called Soap for Sinners. No judgment. I think maybe it's just sinfully good. This soap, I love this soap. Using the soap just makes me crazy happy. So thank you, Soap for Sinners. But we've also done lubricant, and we've done a discount off of, I call it the most Internet of Things vibrator. And we love to support, female-founded, female-led companies.
Yeah, exactly. That's all that good stuff. So if we go back to disparities, how do we address these?
Well, I think we just talked about one, which is awesome. Pandea Health, just being able to X out the middleman or women to be able to directly deliver those goods to the patient is phenomenal. And I think that was one of the reasons that I was drawn to your guys' company so much, because it literally marries public health with medicine and makes this beautiful product to really put the patient at center. And I think that is such a great and creative way to intervene with these health disparities, because I feel especially if someone's parents are getting involved, or if you don't have access to a clinic or a Planned Parenthood or anything, or if you don't even have insurance, because there's a lot of us that don't have insurance because, things are going up and down all the time. And this is one way to be able to bridge that, to reach a community that really needs it. So thank you, Dr. Yen. You're amazing.
No, thank all of you, for joining Pandea Health and helping us and spreading the word. I think we forget about people who don't have insurance. And for those of us that have insurance, we don't realize if you have to go to a clinic and see a doctor, it's usually a blank check. So if you were to go to see me at Stanford, I don't know how much they're going to charge you. It could be 250, it could be 750, it could be 850. And it depends on the complexity of the visit. It also depends on how much time it takes. And so when I see patients for their teen checkup, if the kid has like a billion questions and I have to educate them about drugs and suicide and birth control and sex ed because their parents didn't discuss it or they needed that information, then that visit is going to take longer and it's going to cost more money. But for somebody without insurance, it's not cool to go to a visit and then walk out with $250 to $850 when you just don't know. And so we've taken an unknown and we've turned it into a known. And this is a huge bargain. We used to charge, $40, $50. And if you were to go out in the world, it's $75 for this kind of visit. But to keep up with our competitors, we dropped it to $20 for people who have insurance. And then for people who don't have insurance, we're giving it away for free for this month and possibly going forward. So it's an absolute steal. And you get expert, passionate, experienced physicians. Can't say the same for other platforms, but all the physicians, we list their first name, last name, their academic background, and a blurb on why they are passionate about making women's lives better.
That's amazing. That's truly amazing. And I think that is definitely one huge way to address health disparities is being able to not only provide the actual medication, but providing the education behind it, providing a safe space. That is really something that you don't really get to find a lot, especially if you're in a location that's kind of against all of like, oh, birth control, anti this, anti that, to be able to have this little part of the internet that actually cares about you and is willing to educate you and is willing to, be able to deliver those gifts to you. That's amazing, honestly.
One of my favorite parts of Pandea is actually the blog. I think that is so educational, and they keep it short and very. There's a lot of information in there, good information, and like there are so many different topics and very relevant topics as well. So I really I'm a fan of the blogs.
And the YouTube, because they're going to take this and they're going to chop it up and put it on YouTube, I believe. Yes. But it's also live streaming. And we also have a couple of, basic videos. It just depends how you like to digest your information. Are you a reader or are you a video person? And in our blogs, we do embed oftentimes the videos. But I like the videos because we have different guest speakers. I also like the videos because we launched a basic like new to birth control pills. Here, Dr. Yen's 3 top tips of how to take your birth control, or the pill, the patch, the ring. Which one of these 3 are best for me? Or the basics of emergency contraception. And the thing I always almost try to sneak in every talk that we get together is if your body mass index is 26 or greater, Plan B and its generics are as good as water. So I see all of these activists putting out, on campuses, emergency contraception vending machines. And I was really supportive of it and really excited, but they can only put the over-the-counter one in there. They can't put the prescription emergency contraception in there. And so the over-the-counter Plan B and its generics. If your body mass index is 26 or greater, it's as if you took nothing. So I really think they should put a sticker everywhere they have these vending machines that says, check your BMI. And you can just Google, BMI calculator, punch in your height and your weight. Most people know what it is. And then if it's greater than 26, don't do this. As an aside, they've said you could double up and that may work. And it wouldn't have any no blood clots or any kind of risk, but it would be double the price. And you might have some nausea or whatever, stuff like that. But better that than pregnant. But even better would be to get the prescription emergency contraception, Ella, which under the Affordable Care Act, if you have insurance, is free. No copay, no deductible. If you don't have insurance, then it is $40 for the Ella versus $20 for Plan B and its generics. But if your body mass index is 26 or greater, or just any, I always go with the Ella because it works better at every time point. It works better up to a BMI of 35. If your BMI is 35, then you need to go copper IUD. but why not do the one that your doctor can prescribe in advance of need and that is free and that is better?
But are the over-the-counter Plan B solutions, are they less effective than the prescription ones?
Exactly.
So are they only 80% effective, or?
Well, what I've seen the studies is what percentage of people get pregnant. And so I believe in the 0 to 72 hours, it's like 1% of those people who take the prescription one get pregnant, and 2% of those people who take the Plan B and it's generics. And you're like, oh, it's just 1% difference. But if you look at the other way, it's 100% difference, or 2 times more effective. And if you're the 1%, it's 100% on you, And so again, if it were me, my friend, my daughter, my patient, my whoever, I would want you to have the least amount of chance of getting pregnant. But it is a financial consideration, 40 versus $20. And then, but the other crazy part is at Pandea Health, we just put a minimal amount of profit to cover overhead, stuff like that. If you go in the pharmacy, they may both be $40. So there's not even a price difference. Go with the prescription one. It does require prescription, but if you saw a doctor for your pill, patch, ring, or if you see a doctor anytime, you can always ask them to write for Ella in advance of need. And then if you have insurance, free, no copay, no deductible, go to the pharmacy and ask for the one with the farthest expiration date. Because if you go up, they'll give you the one that expires today because they assume you're taking it today. So you want to you're like, no, I'm being responsible. I'm treating this like a fire extinguisher. I want the one with the farthest expiration date. So 2 years from today, or even more, depending on the package. And my joke is, if at the end of the 2 years about to expire, just go to a campus and college and be like, here you go. It's on the table, even though it is technically a prescription drug. But anybody with a uterus who wants to prevent unplanned pregnancy can take it.
But the best method would just be, to be on regular birth control.
Yes.
Right?
Yes.
So that is the safest. I don't know what is the cap for like taking Plan B and other
preventive? 5 days after the contraceptive accident is what I say. So like my thing is people are like, unprotected sex is what they'll write on the prescription. And I was like, no, it's like, what if they were sexually assaulted? That wasn't unprotected sex. That was unwanted, unneeded, unnecessary sex. Or what if the condom popped? They tried, but then the condom failed them. Or what if exactly with health disparities, I couldn't get an appointment. I couldn't get to the appointment. I had to work that day. Again, it's, not my fault. It's like the world smashing down on me. So to me, it's not unprotected sex. It's contraceptive failure, that we failed to get contraception, or that the condom popped, or, whatever. And so, yes, it's always better to use better birth control, but you have up to 5 days. But I always say do it as soon as possible, because the main way that Plan B and its generics work is if the egg is about to come out, it's about to pop out, it says she's pregnant. And the egg's like, oh, well, I don't want to pop out, because then you'd have twins that weren't having the same birth date, and one would be like 3 weeks older than the other. So that's why the body doesn't pop out another egg when you're pregnant. And so that's how Plan B and its generics work. But you don't know when that egg's going to pop out. So if the condom pops at 3 a.m., I want the medicine in the person with the uterus's mouth at 3:10. I don't want you waiting 5 days, because you heard me say 5 days. The 5 days is for people who don't know. Your friend comes up to you and she's like, oh my God, the condom popped like 3 days ago. And you're like, you got up to 5 days, run, or here's my birth. Yeah, take it. Here's my emergency contraception, So
is there a max though, how many you can take? I mean, over a certain time period. As a young, woman and a college student, I have a couple girlfriends who have
use emergency contraception, right? As contraception. And so they have studied it, interesting enough, that you could take it before you have sex and use it kind of a day of, but know that its efficacy is 70 to 95%, depending where you are in your cycle. If the egg already popped out, it's not going to work for you. If the egg's about to pop out and you get it before, then you could stop it. But if it's almost there, you won't catch it. But if you're on a better not permanent, but like everyday form that covers you, the pill, the patch, the ring, the implant, the IUD, the shots, if I forgot anything there, that, there's no chance of the egg popping out as long as you're taking your medication on time. But with this one, you don't know where I think that's the key, is those without uteruses don't realize that our periods aren't regular. It like moves if I'm stressed, right? Like when I think I'm pregnant, it goes out even farther just to torture me, right? Like you're like, oh my God, I'm late. And that stress pushes it out even farther. Yeah. And so when you do that, you push out the popping out date. If we were popping out at the same time every time, and some people are crazy fertile like that every 28 days, but a lot of us vary depending on stress. And so how high stress you are, I'm very high stress. And so, so then you don't know. And so to answer your question though, how many times can you do it? You can do it as much as you need, but whether it'll work is a totally different thing. So I had a patient and she took emergency contraception and then she had the condom pop and we're like, do we do her again? And we're like, this is just a waste, blah, blah, blah. Ended up pregnant. So we should have done the second one, but maybe there was no hope. Maybe the egg had already popped out. And even if we'd done the second one, she was going to get pregnant anyway. The reason why you don't want to do it again, one, it's not as good as the, ongoing birth control. You don't know how or when it's going to work. And two, it's actually very jarring on the woman's system, the person with the uterus system. As we know, if you've ever taken it, it's like, lah. And then when the progesterone goes down, your body goes, bleed. And so if you were supposed to bleed, 3 weeks from now, you're going to bleed now. Or like if it can delay it, it can bring it sooner. It just screws the system. And to screw the system every other week is not a good idea. Screw the system once a month, maybe okay, but even then not as good as permanent long-term. And the non-birth control benefits of being on the birth control pill patch ring or IUD for me is #periods optional. If you're on the IUD or implant, 30 to 70% of those women will lose their period and then the flip fraction will get lighter. That's an awesome thing. I'm a control freak, so I like the pill. As long as I take my pill every single day, I will have no period except for some exceptions. But in general, I haven't had a period in 11 years as long as I take my pill. And how much better is life without random blood 1 week out of 4? And so, that's the benefit outside of birth control. And my skin. I used to get a zit, the North Star. It would migrate every single month. And I don't remember what time related to my period. My poor 14-year-old daughter, I'm watching the North Star manifest on her face. And I'm like, I'm so sorry. It's my genes on you, this North Star. It's hideous. And as soon as we can safely turn off her periods, assuming she wants to, I will give her that option.
That is, sounds good. Do you guys have anything else to add? Because I think we are reaching the end of our live today.
This was a great review of everything. And I think we definitely did tie in how health disparities and social determinants of health and Pandea's role in it. So I think it's so important. And I just want to add one little tidbit about periods being optional. I think that also plays a huge role into health disparities because and social determinants of health, because when you get your period, you might miss work, you might miss school, which actually determines how well you do and kind of plays into the role in health and everything. So it's this cyclical effect. And I think Pandea's role in it is really helping overall increase health outcomes for people with uteruses everywhere. So I think it's great what you guys are doing.
Yeah, thank you. Yes. I remember when I was working in a lower income community that the young people would miss school, those with uteri, and they would miss 2 days of school or even a week every single month because their periods were that bad. And the first line of treatment is ibuprofen, 600 milligrams with food 3 times a day for up to 5 days. That'll cut down the bleeding by 30%. So it works for a lot of people. But for the people that fails, then the next step is hormonal treatment. And because of either stigma, oh my goodness, if I put my daughter on it, then she'll be having wild, crazy sex. And it's like, no, if you taught her you don't have sex unless you love this person, or that anytime you have sex, you could have a baby with this person for the rest of your life, or that everybody has a sexually transmitted disease, anyway. But that she's using it so she can go to school. She's using it so that she can function. And so exactly as you said, the number one cause of missed school and work under the age of 25 in the United States, not just third world countries, but our country here and now and today, is horrible, evil periods, painful, bloody periods.
I did not know that. That's very interesting. I didn't know that the numbers were that high. I mean, I've experienced it myself where it was just so bad. I just felt like lying down. I was like crippling on the table, like the school desk. I was like, I have to go home. Like I have to miss school. It was so bad.
And it shouldn't be, and the thing, my new phrase is women suck it up. And we need to stop sucking it up. And just because it runs in your family doesn't mean it has to be. It runs in my family to be totally blind. And I don't just be like, well, it runs in my family, so I'm not going to get glasses. I'm just going to like not be able to see anything or contribute to society. And it runs in my family to have horrible allergies. But I'm not going to take my allergy meds because it's not natural. Like we have science to help you. And so if you're having horrible periods and you're missing work or school, if you're feeling cold, tired, your heart rate's beating really fast, people look at you and look like you're kind of pale, then go see a doctor and tell them how heavy your periods are, that you think you might have anemia. And they've actually shown that before you get anemia, you get iron deficiency. But as doctors, we don't check for iron deficiency until you have anemia because we're like, oh, what caused that? And then we go, oh, there's iron loss. And then obviously if you're bleeding 1 week out of 4, that is unnecessary iron loss that we can cut off and then bring you back your anemia. But they've shown that iron deficient people don't have slightly lower IQ by 1 to 2 points. Iron deficient people have lower math scores. And if you put back that iron, the IQ and the math does better. And so women have been docked on our math skills. Part of it is confidence, but might be because we're losing blood and we don't have enough blood to carry around oxygen to run those fast permutations around. And I'm not saying that's an excuse, but I'm saying, why do we have to be at a disadvantage? Why can't we be equal?
That is a good note to end on.
Yes.
Yes, equality. All right, so I want to say thank you, Kritica, for joining us today. And of course, again, Dr. Yen, for your time. And I also just want to remind everyone to use the code Celebrate2021 on our website to get a free doctor's consultation if you pay cash. As you said, Dr. Yen.
Thank you we don't want anybody to be disappointed or angry. So it's just a legal thing that you can't incentivize somebody to get a prescription with a free telemedicine.
Exactly.
Thank you so much for having me.
Thank you.
I learned a lot.
Well, we'd be happy to have you back. It's always fun. And Nina is always a great hostess, engaging and, keeping us on topic. But anytime you want to come and chat about health disparities or any topic related to birth control or women's health, as we expand, we're going to, by the way, launch acne very soon for our current customers. So you got to get in now or else you can't get access to some awesome acne treatment, but only if you need it for people.
Yeah. So if you want to be part of that exclusive group, sign up for our services, pandeahealth.com. All right. Bye, guys.
Bye.